Welcome to GCHB. I had to figure out how to do my slideshow with Dr. Seal.
Yeah, I'm here.
With this funky. There's Maureen. Okay, while we're waiting for other people, why don't we go ahead and go around and introduce everybody. For non-Tulane people, if you would just introduce your name, where you're from, and what degree interest brings you to Tulane. Tulane people, you know, where you work, your relationship to GCHB. My name is Anita Jobson-Wolf, and I am the doctoral coordinator for the GCHB department, and I run all the open houses as well. So I help get you guys in MPH students into Tulane, and then a counterpart, Gail Marie Abbas, takes over from there, and I shepherd the doctoral students through. Welcome to Tulane. Dylan, you want to talk? Guess not. Dr. Doe, do you want to go next?
Sure. Hi, everybody. Welcome to the open house. I am Mai Do. I am a faculty and associate professor in the department, and I am one of the two vice chairs of the department. The other vice chair is Dr. David Seal, and he will introduce himself in a minute. In terms of background, I am from Vietnam originally. I got my MD degree from Vietnam, and then I came to the US a long time ago for public health training. Got both my master's and PhD, actually DRPH degrees from Hopkins, and came to Tulane in 2005. So I've been here for 15 years now. My research is focused on access to healthcare services and quality of healthcare services in the US as well as in Asia and Africa. So I'm interested in things like how does perception of quality affect people's choice of using healthcare services, how other things like women's empowerment or the lack of it may also prevent women from accessing healthcare, or stigma related to mental illness, related to HIV could also prevent people from accessing accessing healthcare services. So that is about me. Thank you, and looking forward to talking with you in the next hour.
Dr. Seal?
Hi, I'm David. I'm the other vice chair, as Dr. Dole mentioned. I've been at Tulane since 2011, so about 9 years now. And I've been doctoral director for about 8 years now. So I'll be talking about the doctoral programs, and if there, for any of you that are prospective doctoral students, whether it be DRPH or PhD, Dr. Doe and Anita handle sort of the admissions part of it, application part of it, but if it's content, then they'll direct you to me. You might notice the green, and can't really see it fully in my background, but there's the crawfish that represent New Orleans, and the logo of the white is actually the big TU for Tulane University logo that our university uses. And embedded in the white is depictions of Botswana. One of my MPH students actually, this is a tapestry she made for me during her Peace Corps experience, and the Botswana part reflects her Peace Corps experience, and the crawfish reflects her New Orleans experience. So it's a very special tapestry for me in my living room. My research is in HIV prevention with incarcerated populations, with men who have sex with men, injection drug users, sex workers. I also do a lot of sexuality, masculinity research, and some research in violence prevention. I teach a sexual health class from a public health perspective, not a human sexuality class, but a sexual health perspective. I teach the intro to qualitative methods. I run the doctoral seminar, and if we can, I teach a 2-week immersion course in Taiwan between the spring and summer semesters, where we'll bring 10 to 12 Tulane students to Taiwan and match them with 10 to 12 Taiwanese students from our 2 partner agencies or universities, Asia University and China Medical University. And it's a wonderful course. We had to cancel, unfortunately, last year because of COVID, and remains to be seen whether we'll be able to actually do the course in May. I'm growing increasingly pessimistic, but still, it's a wonderful time, and I'm really, it's very disappointed when I had to cancel. So just see me around someday when we're not so virtual. And anyway, I welcome all of you and look forward to this next hour.
Thank you. Maureen, do you want to say something?
Hi everybody, my name is Maureen. I am actually the GCHB graduate assistant. Welcome to Tulane. I am in the office to help with any questions you guys may have. I was a GCHB student, but then I changed programs to tropical medicine. But I'm more than willing to help you guys figure out any questions you may have about anything. Just send me an email and I'll be happy to respond.
She answers if you email GCHB at Tulane, you usually get her first. But Elisa, Elliot, do you want to start?
Yeah, sure. Hi, I'm Elisa Elliott. I'm from the University of Hawaii. I'm currently working on my master's degree in epidemiology. My research interests are in global health, specifically looking at global maternal-child health and refugee access to different healthcare resources and educational resources. Nice to meet you all.
Thank you. Talata? Am I saying that right?
Close enough. My name is Tereta. I'm a faculty member at the Johns Hopkins School of Public Health. I work mostly in maternal and child health research, and I'm interested in the PhD program. My interests are in the intersection of sexual and reproductive health and maternal and child health. Good to be here.
Welcome, Mary Wakefield.
Hi everyone, my name is Mary Wakefield. I have my MPH from St. Louis University, and I currently work managing a prospective birth cohort here at the University of Illinois in Urbana-Champaign. We work with pregnant women and children looking at exposures in pregnancy and then development in children. My research areas of interest are mental health and mental health access, and then health access for refugee and immigrant women.
Thank you.
Actually giving a lecture for SIU today.
Oh, very cool.
Zika?
Hi everyone, my name is Zykia McCurdy. I'm from New Jersey. I actually just finished up a master's in integrative medicine from George Washington University. I'm interested in my MPH, specifically focusing on nutrition. I aim to reduce food insecurity, create accessibility to different health programs, especially holistically based, to tie in my integrative medicine background. I am also a national board certified health coach, registered yoga teacher, and I currently work for the Robert Wood Johnson Hospital System in New Jersey as a part of their employee wellness program.
Very cool, thank you. Caroline?
Hi, everybody. My name is Caroline Helson. I am living in New Hampshire right now. I'm from New York City, and I work full-time as a director of marketing and communications for a workforce development nonprofit. We help. One of our career strands is actually health sciences and helping high school students find career paths in the health sciences field. But most of my public health interest and my interest in getting a MPH at Tulane is focused on health communication and how we're taking policies and programs and making sure they're well communicated and understood and accessed throughout communities. I am a volunteer for NAMI New Hampshire up here in New Hampshire, and am a teacher for our family to family class for family members who care for adults with mental illness.
Very cool, thank you. Adrian? Sorry, I can't hear you.
I had the old double mute on because I'm on my phone. Sorry about that.
That's okay.
Hi. Hi, my name's Adrian Pizzatella. I received my master's degree from Columbia in public health a few years ago. Since then, I've been working at Bloomberg Philanthropies. We mainly fund, on the public health team, we mainly fund non-communicable disease risk factors. So our primary programs are things like tobacco control. So right now I'm just exploring options. I support a lot of our kind of research and data pieces within the organization. So right now I'm just trying to explore options for PhD and DRPH programs. Based on my background, I'm pretty interested in areas that support kind of the intersection of policymaking and research, and how research can move forward policymaking. So especially within tobacco control, I'm interested in looking at emerging products. I also work on a program called Data for Health that really centers around improving CRBS systems. So I'd also be interested in exploring some health systems research.
Thank you. Catherine Hawthorne? You're on mute.
Sorry about that.
That's okay.
Hi, I'm Catherine Hawthorne. I am a prospective MPH student for international health. I have a BA from Bryn Mawr College in anthropology, and I'm primarily interested in kind of international health policy and how international health policy interacts, particularly in high-risk situations such as a pandemic or refugee situations.
Interesting, thank you. Should check out our one center here coming up. Brianna?
Hi, I'm Brianna Juma. I'm currently studying at the University of Nebraska-Lincoln with a dietetics and nutrition health sciences degree. I'm interested also in the public health nutrition program at Tulane, while also hopefully integrating the dietetics internship as well along with that. Similar to Zykia, I'm interested in looking at the root causes and addressing food insecurity in our communities and increasing access to healthy food. I'm currently working on some research looking at SNAP and accessibility in my local community here. So that's me.
Okay, I'm trying to follow names here and I'm not sure. If I miss you. Val Serino?
Hi, my name is Val Servino. I studied public health at the University of Louisville in Kentucky. I'm applying to the Community Health Sciences MPH program. I'm interested in studying the impact of human rights disparities on the health of LGBT communities in the South, which is what interested me in Tulane.
Thank you. Alana?
Hi, good morning. I am currently living in New Orleans. I'm a teacher with a program that combines culinary and garden education, and we focus on nutrition and social emotional development. I went to Tulane for my undergrad, where I studied Latin American studies and public health, but I've been teaching with this program for 5 years, and I'm interested in applying to the dual MPH MSW program and I'm interested in nutrition, food access, nutrition education, and culinary therapy.
Very interesting. Deborah Winberg.
Hi everyone, my name is Deborah. I recently graduated from the London School of Economics with my master's in international health policy, and I'm right now working for a group called the Health Finance Institute, where we work on blended finance models for non-communicable diseases in lower middle income countries. And I'm applying to the doctoral program, and I'm really interested in finding ways to better show the value of diabetes interventions in global communities to include more ethical and health externality measures to then show better value and create better pricing and access to medicines.
Thank you. Jane.
Hi, everyone. I'm Jane Berry. I graduated in 2019 from Washington University in St. Louis with a bachelor's in anthropology and a concentration in global health. I was then with the Peace Corps. I was a community health educator in Cameroon for only 6 months, unfortunately, before we were all evacuated in March. And I was working mostly there on community health, particularly with maternal health and nutrition, and also HIV/AIDS. And then since then, I've joined an organization, a sort of like alliance of organizations in the US trying to advocate for the community-based workforce during the pandemic and make sure especially the community health workers are being involved in the state response efforts that are going on right now. So I sort of haven't really decided if I want to do global health or community health here in the US yet, but I was especially excited by the community health sciences program, MPH, and also combining it with an MSW. So thank you.
Thank you. Hannah?
Hi, everyone. My name is Hannah Crockett. I'm a returned Peace Corps volunteer, served from 2016 to 2018 in Guinea as a public health educator, and got my my bachelor's in linguistics and Middle Eastern languages. So I'm kind of interested in working with refugee migrant populations, international health policy, and humanitarian response. So here to just kind of meet you all and learn a bit more about the program.
Thank you. Kate?
Hi, everyone. My name is Kate Gallagher. I am from San Diego, California. I have a bachelor's degree in economics from UC Santa Cruz. I've been working in economic development for the last 5 years. I am interested in the MPH nutrition program, in particular the nutrition as a measure or preventative measure for chronic disease. Thanks.
Thank you. Mariah?
Hi. I am interested in the MSW MPH program. I currently work for a nonprofit that does youth development work, and then I also do abortion and birth doula work in New York. And I'm interested in the maternal and child health program, as well as the community health program. And I'm interested in addressing structural violence and racism in healthcare delivery and reproductive health.
Thank you. Denise?
Hi, everyone. My name is Denise Catbay. I am interested in Tulane, particularly in the Department of International Health and Sustainable Development. Currently, I am working for the International Agency for Development in HIV/AIDS commodities and supply chain management, and have experience also working on reproductive health policy. So that's what I want to pursue in a master's program at Tulane, is the intersection of supply chain and reproductive health access. Nice to meet everyone.
Thank you. Nice to meet you. Emma?
Hi, everyone. Nice to meet you. My name is Emma Halper. I graduated in 2017 with a BA in International Relations with a focus on human rights and conflict resolution in Latin America. I now work at a DC-based global health NGO called PSI, where I'm the program manager for our portfolio in Southeast Asia. And I'm very excited about Tulane's programs, specifically the MPH in the community health sciences track, as well as the international health and development track. Nice to meet you all.
Thank you. Lizette, Liz, I'm sorry, Lizette, I'm mispronouncing this, Miss Perez, I'm sure.
Hi, no, that's okay. My name is Lisette Perez, and I graduated in 2019 from Rice University with a BA in psychology and a minor in global health. And I'm interested in the community health sciences with the focus on mental health, such as like working with refugee populations or postpartum depression.
Thank you. Yeah, I'm going by what's on your thing, so.
Yep, that's my name. Hi.
Okay, cool.
Hi, my name is Ya. I also was a RPCV serving in Senegal, but also got evacuated this past March. I'm interested in Tulane's International Health and Development Program, maybe a dual degree in MSW as well.
Thank you. Whomever's on the phone, no name.
Hello, everybody. My name is Jessica Espinoza. I graduated from the University of Kentucky with a bachelor's in public health and a minor in biology. I was also a Peace Corps volunteer, a water sanitation and hygiene volunteer in the Andes Mountains of Peru. And I'm interested in global community health, specifically international health and development, and potentially a duo Master's of Public Health and Social Work. Nice to meet you all.
Nice to meet you. Gail Marie, do you want to do a quick hello?
Good morning, everybody. I'm Gail Marie Abbas. I'm the Academic Program Manager for the GCH MB MPH programs. So I will be the person who helps you with the administration of going from admission to graduation. Nice to see you all here.
And did I miss anybody? No? Okay. We're going to see how I can move my screen here. So we're the GCHB, which is Global Community Health and Behavioral Sciences. And if you're interested in nutrition, maternal and child health, community health, health education and communication, or international health, we are currently the place to be. Our mission is community-based research and prepare future generations of highly skilled and culturally competent public health professionals to go out and make the world better. We are 40 full-time faculty members, 6 full-time departmental staff. We have 200 plus master's students. That includes MSW MPH, MD MPH, as well as people getting a certificate in dietetics. There's 35 plus doctoral students, 3 research centers. There's actually 2 training programs and 1 institute. I'll have to change that. Dr. Doe, I think this is where you wanted to start talking, right?
Yes, thank you. We offer 6 different master degree programs in Master of Public Health, and also dual programs with Master of Social Work, and also another dual program in medical in medicine. We have 2 doctoral programs, 1 PhD and 1 DRPH program that Dr. David Seal will talk with you later, and a non-degree program, the dietetic internship, I think similar to what Brianna mentioned earlier. Within MPH programs, currently we are offering 6 different programs, including the 5 existing one and a new one. The first program in international health and sustainable development, this is and you have the names of the directors of the programs and their emails there if you want to reach out to them to learn more about the programs.
And I will email this slide set to everybody, so you don't have to worry about copying it right now.
Good idea. So the first one, IHSD, focused on public health problems of populations worldwide, mostly in developing societies. Some of the faculty in this program also work on public health issues with vulnerable populations, myself included. So I work a lot with Vietnamese immigrants in the US, for example. The curriculum of this program is strongly driven by overseas research and practice by faculty. The second program there, Social Behavior and Population Sciences, is the new program that we will start offering in fall of 2021. This program focused on social determinants of health and health equities. We aim to provide you with skills and knowledges in theoretical and evidence-based models for health promotion to address health equities. The third program, Community Health Sciences, is focused on knowledge and skills in working with communities, how to run the community-based programs, how to engage with the communities in those programs. And then we have health education and communication. This one is pretty clear just from the name, focused on the design, planning, implementation, monitoring, and evaluation of health education and health promotion programs. MCH program, looking at provide you with knowledge of biological, social, cultural, and behavioral issues related to the health of the mothers, infants, children, adolescents, and their family. And the last one, nutrition, is looking at social and environmental determinants of nutrition and food security. So we're looking at, for example, the faculty would be looking at SNAP program in the US, undernutrition, overnutrition in the US and elsewhere around the world. Next one, please. Hi, I think several of you mentioned that you are interested in the MSW and MPH program. This degree is designed to, for those wishing to pursue a career, working closely with families and children. So you would take coursework from both schools. The School of Social Work is only a block from us, so that would make it a lot easier. And you would need to complete 86 credits. So it will take a little longer for you to complete. And our contact faculty is there. The name is Aubrey Marcour in our department. I think Anita, maybe we can add her email address in the chat.
Right, and I'll add Dr. Beasley. The main thing on this too is you apply to social work and you apply to SOPHIS, to the School of Public Health. You have to do both applications and be accepted in both in order to complete this.
Mm-hmm. And as far as I know, most of the dual degree students are in the CHS program in our department. So yeah, I would strongly encourage that you contact Dr. Aubrey Marcour and talk with her about the curriculum.
Right. And one of the things with the Community Health Sciences MPH is that you take basic courses, but then you get to pick a concentration. So if you're torn between a couple of things, you could do CHS and then, but then specialize in health communication, maternal child health, nutrition, that type of thing, and get the best of both worlds.
That's true. That's correct.
There we go.
And lastly, nobody has mentioned this dual degree program yet, interest in this program yet, but we also have a program in MD and PH. So students would be admitted to the School of Medicine, which is also a couple of blocks from us, and they would be offered the opportunity to apply to the MPH program. So they would complete the MPH program usually in the first 2 years, because from year 3 to year 4 of the MD program, there's a lot of clinical work. And the contact email is also there if anyone is interested.
Dr. Seal?
Hey, so we have 2 doctoral programs. I'm currently the director of both. The DRPH is an applied degree, much like the MPH. It has a lot heavier focus on monitoring, evaluation, advanced program planning, field applications. Typically, the students in this program do not go into academic work, but they go into applied work after they graduate. We started a new class in that program of leadership and management. It's a 72 credit program. You can apply up to 36 credits of relevant master's level training to that degree. So if you come in with an MPH, it's likely you'll be able to apply 36 credits to the degree and have only 36 left. Most students finish their coursework in both the PhD and DRPH in 2 years. They both require a comprehensive exam. They both require a dissertation, and the DRPH has the additional requirement, generally 300 hours of practicum, applied learning experience. Right now, it's 200 just because we're in COVID situation, but that's temporary until COVID passes and we're back to kind of resumption of somewhat of a normal life. So that's the DRPH. I currently have 10 students. We have 42 doctoral students total, 10 are in the DRPH. The PhD is much more focused on biostats, epi research methods, really preparing people for careers in policy or in research policy institutes, academia, faculty positions. It's really that's what it's focused on. Most people from I can only think of one of our PhD graduates since 2011 that did not go into academia or a research policy institute. So it's much more on that angle. Having said that, there's a lot of overlap because a lot of our DRPH students are very involved in research that they apply to their practice, and many of our PhD students do very applied dissertations. So I have 2 students of mine. One was DRPH and one is PhD, and they have identical dissertations in terms of format and developing curricula. Different content, but the format of how they structured their dissertations were exactly the same. So I think that exemplifies it. I run it as one program. When we run first-year doctoral seminar, which is required of all first-year students, we run it together. So I don't value one over the other. They're both, they just serve different purposes. And there are, as I mentioned, 32 PhD students right now. So that's it.
So we also have quite a few centers. We have Center for Studies of Displaced Populations. We have the Tulane Center of Excellence in Maternal and Child Health, Education, Science, and Practice. There's the Mary Amelia Douglas Whitehead Community Women's Health Education Center. We have a Violence Prevention Institute. We have the Tulane MCH Nutrition Leadership Program, and we have a dietetic internship program, which is a certificate program. The CSDP, I always get that backwards, but that's the Center for Studies of Displaced Populations. Several of you mentioned migrations, migrants, that type of thing. This would be the place to hang out and talk to and possibly get some research experience with. Mary Amelia, or the MAC, the easy way to say it, outreaches a lot here in the city with the women and family. And please stop me if you guys have questions. Stop us and we can chat with questions. The CAMSH works with mainly the MCH students, but they do have open seminars that everybody can attend and do. Violence Prevention Institute. This is based in our department, but it's really university-wide because they pull in, they track what the entire university is doing in regards to violence and tracking and that type of thing. They're on Facebook and Instagram. The Tulane Nutrition Leadership Program. You do have to apply separately for this, but you also have to be already a registered dietitian in order to get before you can do this program. We do a lot of research in all sorts of areas. We explore lots of drug abuse, risky behavior, undernutrition. Dr. Seal and Dr. Doe gave you sort of an update of what they were doing currently. We span the globe. We are all in every continent except for Australia and Antarctica, or at least currently. We're in the US, we're in Africa, we're in Asia, we're in Peru, in the Caribbean, and Latin America.
We also have people that work in the Middle East.
Yes.
So
that was not the right slide. That slide didn't get updated correctly. The viral, we're employed all over the place. We have prevention coordinators at Department of Health. We have professors. We have workers at Planned Parenthood. You name it, we're pretty much there. You can find Tulane all over the world. Quite a few different partners. There's other universities, non-NGOs. All these partners will also help you get a practicum. You do have to find your own, but your professors have a lot of connections with these people and they can help you find the right one for you. You do have to, MPH and DRPH do have to complete a practicum, and but please do not, if you get an email from someone saying, "Ooh, you should pay for your practicum, come work for us, and you pay us." No, don't do that. Please check that out with us before you sign anything or pay anything. Some examples of what people have done: they've worked at Healthy Start New Orleans, they've worked at Edible Schoolyards, worked up at Haven from Hunger. You've worked all over. We've had several people in Cambodia either working for this compliance, the UNICEF in Cambodia, but they've also worked for the Helen Keller Institute in Cambodia. As Dr. Seal mentioned, we usually have summer courses abroad. Hopefully we'll get to do it this summer. We have his course in Taiwan. We have more of a nutrition course in Italy. And we have a course in Cuba. The Cuba class, it would be better if you speak Spanish, just because they don't have translators for the doctors and public health professionals you're talking to, and it'd be easier if you knew Spanish.
the School of Public Health also has in other departments a summer course in China and another one in Senegal.
Right.
And in Suriname too, I think, in environmental health.
Yeah.
That's what I meant. Thank you, Dr. Doe. Senegal, not Suriname.
So we offer multidisciplinary faculty. We have, as Dr. Doe said, she had a medical degree and now has a DRPH. We have a economist, we have demographer, we have all sorts of interests. Wide variety of courses. We're very active with research and strong collaborative link. And then Dr. Doe.
Okay. So I'm delivering the news. So beginning on July 1st, 2021, we, as the biggest department in the school now, we are going to become 2 departments. So essentially the people who are here are still here. We are regrouped in 2 departments. One will be social behavior and population sciences. This group will include faculty whose work is fully grounded in social and behavioral sciences, and they examine a variety of topics in the US and around the globe. The second department, International Health and Sustainable Development, the group will regroup to also bring greater attention to the school-long history and distinguished history in international health, and bringing the curriculum that is more focused on the present and sustainable future of international health around the world. So next slide, please. As we become 2 new departments, most of the MPH programs that we are offering now in nutrition, health education, CHS, MCH will remain. So you can apply to these programs to start in the spring of 2021, summer or fall of 2021. The new MPH program in SBPS that I mentioned earlier will begin in fall 2021. In IHSD department, the current program in IHD will be renamed as IHSD and remain open for enrollment throughout the year. All the criteria for admissions, the admission process will remain the same. Most of the curricula are going to be the same, with the exception of SBPS because it's a brand new program. So I want to emphasize that everything stays the same. The faculties are going to be here, same people. We actually had a few new faculty over the year. And as we become 2 departments, we are going to have a couple more new faculty as well. Regardless, whatever you enter in, you will be able to finish the program that you enter in. And then the doctoral program, Dr. Sion is going to talk about that.
Yeah, so the way it will work, the DRPH has historically only been in GCHV, and it will continue to reside at this time only in the new Social Behavioral Population Science Department. The program itself will not change other than we were able to add the Leadership and Management course that I referenced earlier. The PhD program is going to be a joint program between the 2 new departments, at least for the first year, which means that any students that enter into the, I guess it'd be 2021 academic year in the fall, you will be given the opportunity to declare which department you want to be housed in as we move forward. Regardless of which department you choose and regardless of whether IHSD develops a separate doctoral program, that's still under discussion, you will come under the current requirements that we have for that program. In terms of what we're doing now, again, nothing's changing in terms of content. I did neglect to say earlier that in the PhD program, you can transfer up to the DRPH is 36, that's a C, the accreditation body requirement. The PhD, you can actually transfer up to 42 credits. So potentially if you come in, for example, with an MPH, have only 30 credits left to complete at Tulane, even though it's technically a 72 credit program. So don't be, if you're applying to doctoral programs, don't be concerned about the separation of departments. We anticipate, I think that the current thinking is that there will still be extensive collaboration between the 2 groups. We may end up not even moving and just having our offices on the same floor because it's been a very successful collaboration. We've developed a lot of really great relationships. So what's posted on our website now for GCHB is going to be what's posted, and it shall come under when we move to SBPS on that. Thanks.
Okay, that's it. We're open for questions now.
There was a question in the chat box about plans to phase out any of the concentrations, and I assume that you mean the MPH programs. So we currently do not have any plans to phase out anything yet. But the school is reviewing their MPH program in general, and so if whatever the strategic areas that the school may decide, we will need to follow and act upon that.
Any other questions? Now we have a question from Alana. Can you pursue a DI while in master's if you do not have an undergraduate degree? You do have to have all the dietetic courses that are required and it's all the courses are listed. You have to have the dietetic background in order to pursue the DI program. I think if that answers your question, Alana.
Yeah, and just to add, I was on mute when I started to talk to the comment before, is the current PH programs. So while the SBPS will start as a standalone program in 2021, as well as the IHSD, the other programs, nutrition, maternal child health, health education, communication, and well, I guess those three will also continue for another year. So if you, like, for example, next year applied for the MCH or the nutrition, you would be grandfathered in even if we go and ultimately eliminate that degree. So whatever you're admitted under is what you're grandfathered into and will be under those regulations for your degree, and that's what will be awarded.
Question about all MPH students, regardless of the program concentration, able to engage with research centers housed in the department? Yes. You definitely can be associated with any center in the department as well as other centers in the school.
School medicine, school social work.
We actually encourage that because so for in the MPH programs, you would have some core requirements by the school, core coursework by the school, and there are also required classes by the department and the program that you are in. But beyond those credits, you have a large number of elective courses that you can take either within the department or with other departments, and that's also applied with your research experience.
Right.
We encourage cross-department experience.
On the Uptown campus, there's the Stone Center for Latin American Studies that I know some people have taken classes with there as well, getting background on their interest in Latin America or South America. There's also the Phyllis Taylor Center for Social Innovation and Design and Social Innovation, something like that a lot of people have worked with as well. And they have interesting weekend workshops and that type of thing. Yeah, I was wanting to speak more about the practicum. Do you have to pay for all expenses? If you mean your living expenses, yes. You have to be registered for the practicum. There is no credit attached, but you are considered a full-time student when you're registered. Expenses, yes, you have to pay for your living expenses. There should not be an expense to the agency that you're working for. You should not be paying them to go work for them. Yes, you do not have to, well, currently they can't intern outside the US, so they're doing stuff in the States, but you do not have to go outside. Most people do when they have the chance, but you do not have to intern outside the US.
When we are back to normal life, I think the IHD program strongly encourage that MPH students do their internship outside of the US, or at least with an organization that work internationally, work right. Outside of the US. And I think somebody mentioned that they are working for PSI. That's one of our big partners in international health and development programs.
Right, and I believe
even a lot of students that aren't in international health, I've had several advisees in health education and in community health sciences, which will now be the SBPS, that have chosen to do practicums in other countries, either because they had previous affiliations through their professional work or Peace Corps, or when I teach my Taiwan class, typically there's 1 or 2 students who have stayed on in Asia to do practicums since they're already over there for the summer. And whether it be Hong Kong, Taiwan, China, Philippines. So I think, if you want an international practicum experience, regardless of degree program, you'll be able to find opportunities. And a lot of our faculty work overseas too that can create links for people.
Yeah, they all had a strange summer this summer. They actually had to stay in the States and couldn't go abroad. But for your expenses too, I believe if you talk to the financial resources gentlemen, and I think there's an open house for them today as well, that your expenses like your flight or that type of thing can be rolled into your financial aid. I know it can for the courses, the overseas courses. So,
yeah, all overseas course expenses can be, you can receive financial aid for. So I know most of my students in Taiwan, that includes airfare, basically includes everything except your personal expenses. You know, if you have housing costs, like my course has, all the courses have surcharges. It typically covers your housing and transportation once you're in the country, but those things are all you can get a financial aid for.
And Adrian wants to talk a little bit more about the dissertation. You mentioned the multi-paper, multi-manuscript versus one. That's what the majority of our students are doing and they get the choice. They can either do one dissertation, one paper, or do a 3-paper model. Most of them seem to be going towards the 3-paper model, but it's not, you can choose. It's up to the student and the advisor to decide which works better for their topic. It's not a requirement.
Right. And functionally, since they all have to fall under the same umbrella of topic, I personally, different faculty have different viewpoints on this. My personal opinion is they're one and the same, because whether you do a sort of one, you know, study model that has different components, or whether you break those components down into defined papers, at the end of the day, and you know, in human research, we may propose 3 really good distinct papers, but realize that one of them, there's nothing there when we actually do the research. That's why we do the research. Or we may decide one of our papers really is 2 papers. And so we end up with 4 papers, you know, and that really to the way we've set up our dissertations is when the faculty makes a determination at your prospectus defense that you have a scientifically viable study that can ask important questions, you know, we can't hold you accountable if you've done the research with fidelity and one of your studies doesn't come out as hypothesized. I mean, we've all had that as investigators ourselves. That's why you do the research, right? If we do the answers, we would do the research. So really it's about the conduct of that. And we don't have a requirement in GCHB or in SVPS that you have to have 3 publications to graduate. You have to do the research that was proposed with fidelity and show, you know, the results. Many students like the structure of a 3-paper model, but that's kind of the overall program philosophy on that.
Okay. Anything else? We're getting close to our hour here. I will, as mentioned before, I will email everybody the slide set, the handout, which you would get if we were in person. So you'll have my email. If you want it, my email is ajobson, J-O-B as in boy, S-O-N, @tulane.edu. Feel free to email me or use gchb@tulane.edu. And we will look forward to seeing your applications in the SOFIS system.
I will just say the other thing that I always, when I meet with prospective doctoral students or master's students, you know, obviously with COVID, everything's different. But assuming you're back by fall 2021 to be in person and in class, I think Tulane, of all the institutions I've been, both as a student and the faculty, I think one of our strengths is we're very collegial. We're very open and welcoming. You know, under normal times, people are in the hallways. Faculty run open door policies. So if you knock on our door, unless we have an urgent deadline or something, we'll take time or we'll make time to set up a meeting. We're really accessible. Most of our faculty are really good about answering email if you reach out to them. So I think we're, you know, and I know that I've had a lot of doctoral students that have, when I ask them, like, what made you choose Tulane? I said, when we visited, we just felt welcome, and we felt like this would be a place that would nurture us. And I think that's something that we as a School of Public Health take a lot of pride in. Certainly our department takes a lot of pride in it. Mentorship, teaching are valued. And I think, you know, it's one of our strengths is that we're really welcoming, nurturing, we care about our students. And, you know, that's important if you're going to go somewhere and invest 2 years or 4 years or 5 years in the doctoral program, that you have a place where you can feel comfortable. Doctoral students is, you know, we've been able to house them on our floor so that they have a sense of community on one side of the building. So, you know, keep those things in mind because they are important as students. Right now it's different because, you know, we're kind of all on Zoom, but we still try to foster it. But certainly when we go back to being in person, we can foster that again.
Okay. We've listed some of the emails on the side, especially for Dr. Madcore with the MSW MPH program questions. But if nobody has anything else, I will stop recording and say thank you, and we look forward to seeing you.
Oh, and just one more thing. If you need to talk with me or anyone about the MPH programs, my email, I'm just putting my email down. There was a question here. Oh, I responded privately to someone.
Yeah, and I just sent my email in the chat, but it's just DSEAL. Just like it sounds. Or ask Anita, she can send it, you know, send it to Marina and Anita, and they'll direct it to us.
And mine is MBO, mine is very short. It can't be any shorter than that. It's hard to forget. Yeah, so feel free to email with questions, and thank you.
Thank you.
All right.
Thank
Bye-bye.
Bye.
Bye.